Which one is the best exercise to improve your cognitive health? Aerobic exercises. What if I told you that there exists a magic pill which if you take, you can reduce your risk of cognitive decline? Not only that, the more you take this pill, the more you reduce your risk of cognitive decline. On top of that, this pill, if taken correctly, is not associated with any major side effects. Well, that all sounds like a fantasy, but it's not. This video is a part of 7 video series where we are going to talk about different lifestyle measures that you can do to reduce your risk of cognitive decline or developing dementia. And the magic pill that I'm talking about is exercise. Now, when we talk about exercise, there are so many different forms of exercise to choose from. There is aerobic exercise. This is where you move the big muscles of your body and you move in a rhythmic fashion to increase your heart rate as well as your respiratory rate. And this includes activities such as cycling, jogging, dancing, swimming. And then there are exercises where you do strength training. So you're lifting weights in a gym to increase your muscles and to improve your chances to avoid falls. Along the same lines, there are exercises which improve your balance, for instance, yoga and Tai Chi, which prevent falls. And then there are exercises that help maintain your flexibility, such as stretching and yoga. So when we have so many options to choose from, which one is the best exercise to improve your cognitive health? Well, the answer to that question is aerobic exercises. And why is that aerobic exercises work best to improve our cognitive health? Well, when we are doing aerobic exercises, we are releasing a substance called as brain-derived neurotrophic factor in our bodies and our brains. And this substance goes and acts specifically on our memory centers, which we also call as hippocampus. And what it does is it actually increases the size of the memory center, which is one of the most fascinating things, that you can just increase the size of your memory center by working out. Well, this is also one of the areas that is heavily impacted in Alzheimer's disease. So what we see in Alzheimer's disease is the hippocampi shrink, and with exercise you can actually increase the volume of the hippocampus. So makes sense that aerobic exercises are associated with an improved outcome for your cognitive health and of course for your cardiac health. But then since we are talking about using exercise almost as a prescription, then the next question arises, how much exercise should I be doing? So when we talk about aerobic exercise, we think in 2 terms. The first thing that we think about is the duration of the aerobic exercise, and the second term we think about is the intensity. So the American Heart Association recommends doing at least 150 minutes of moderate intensity exercise in a week, or you could do 75 minutes of vigorous intensity exercise in a week, or you could do an equivalent combination of these. Now, when we think about 150 and 75, that seems like a lot, but the recommendation is actually to divide them into smaller chunks over the week. So for instance, if you choose to do moderate intensity exercise, you could do 5 sessions, 30 minutes each in a week. So you could choose 5 days where you can work out up to moderate intensity 5 times in a week. Similarly, if you choose to do vigorous intensity exercise, you can actually go down pretty low on the time. So you can just do 15 minutes of vigorous intensity exercise 5 times a week. So remember how at the beginning of the video, I mentioned that the more you took this pill, the more you're going to improve your cognitive outcome. So instead of doing 150 minutes of moderate intensity workout, you could do 300 minutes of moderate intensity workout, which comes out to be 60-minute chunks of exercise 5 times in a week. Or instead of doing 75 minutes of vigorous intensity exercise, you can do 150 minutes of vigorous intensity exercise in a week, which would look like 30 minutes of vigorous intensity sessions that you do 5 times in a week. Or you could do an equivalent combination of moderate as well as vigorous intensity exercises divided over the whole week. Now, the question then comes, what if you are someone who has a health condition such as a cardiac condition or a lung condition? Or what if you are someone who's just starting on their exercise journey? Well, in that case, we have to follow 2 guiding principles. Number 1, you need to check with your healthcare provider what kind of of exercises would be safe for you and how much could you exert. Number 2, if you are someone who's just starting off on their exercise journey, the recommendation is to start low and go slow. So for instance, if you are someone who doesn't do a lot of exercise, the recommendation would be to actually start with light intensity exercise. This would be something like a light walk or a stroll. And as and when you become more comfortable with light intensity exercises, also always listening to your body, you can then progress to move on to moderate intensity exercise and eventually to the vigorous intensity exercises. Using this approach, you minimize any exercise-related injuries. But then the question arises, how do we even know which is the intensity of exercise that we are doing? I basically go and take a run. I don't know whether I am in the moderate zone or the vigorous zone. How do I even know? To our rescue comes the digital watches. Most of us possess one or the other kind of digital watches, and we do see a number that is called as the heart rate. Now, heart rate is a number that is telling you how many times in a minute does your heart beat. You may have also commonly seen when you go to a doctor's office, they usually feel your pulse and look at the watch or the clock and determine how many times your heart is beating. And nowadays they also use a pulse oximeter to look at your heart rate. But in day-to-day practice, we do find a lot of individuals using a smartwatch, and that does give you your heart rate. Now, in terms of looking at the heart rate, it's really important to know what is your resting heart rate. Usually, this is a number that ranges between 60 to 100. Also, to determine what is the intensity of workout that you are doing, you need two more numbers. The number that you need is the maximum heart rate for yourself and the heart rate reserve. So how do you determine maximum heart rate? There are various measures, and depending on certain health conditions, one method is preferred over the other. For our practical purposes, let's choose the most simplest method. So in this method, to determine your heart rate, what we do is we subtract your age from the number 220, and we get a number that would be the maximum heart rate. So for instance, you are someone who's 60 years old, your maximum heart rate would be 220 minus 60, which gives me the number 160. Now I have two numbers, an upper bound called as the maximum heart rate and a lower bound that is called the resting heart rate. The resting heart rate is your heart rate when you are really relaxed. For example, you are on your couch watching TV and activities like that. So now we have these two, an upper bound and a lower bound. And the difference between these two is called as the heart rate reserve. So imagine you are someone whose resting heart rate is 60. So the maximum heart rate minus the resting heart rate in your case would be 160 minus 60, which will give you the number 100. And this is called as the heart rate reserve. And this is the number that you can play around to know how much could you increase your heart rate to meet the criteria for moderate intensity versus a vigorous intensity exercise. So if you increase this heart rate reserve number, which in our example is 100, by 50 to 75%, then you are in the moderate intensity of the workout. And if you increase it from 75 to 80%, then you are in the vigorous intensity of the workout. So for the purposes of keeping this example simple, let's assume you want to increase your heart rate reserve, which in our example was 100 by 50%. 50% of 100 is 50 beats per minute. Now you take this number and add it to your resting heart rate. That was 60 in our example. So 50 plus 60 gives you 110. So if you are someone who's 60 years old and your resting heart rate is also 60, then you need to increase your heart rate by 110 to meet the criteria for moderate intensity exercise. So hopefully this video was helpful. Please also check out my other videos where I talk about optimization of your diet as well as sleep. In my next video, we will tackle another lifestyle measure, that is stress management. Till then, take care and goodbye.